All right, so we can start today. Hello, everyone. My name is Yana. I'm the General Secretary of the SCORE Committee, and we would like to welcome you here to today's webinar. Thank you for joining us. And we hope you will like today's webinar. We have this week the African series webinars, and we hope you will enjoy today's guest. And I would like to give the floor to our webinar coordinator, Mahinor, and she will continue introducing our dear doctor and the webinar. So thank you very much.
Thank you, Anna. Thank you very, very much. I'll introduce myself again. My name is Mahinor Gadullah. I am the IADS Webinar Coordinator. And I'm really, really happy and glad for this webinar month of the African region. And I'm very, very happy to see a lot of you guys again, the participants. I love to see the repetition, see you guys always attending. And please do attend our last one for tomorrow. And to begin with, let's enjoy Dr. Zineb Bennour. I'm very, very happy and I'm very excited, honestly, with her today. And just looking forward, honestly, to this lecture because I believe it resonates with everyone, not just as dentists, but it would resonate with us as individuals that are part of their family, to actually help our family all together, to guide, to look at all the kids we have siblings or as family members, to tell them what to check them, to go to the dentist real quick, and for us to be the first one to identify that. So today we're going to be honored with Professor Dr. Zineb Bennour from Morocco. She's an associate professor in the pediatric dentistry department of Mohammed VI Faculty of Dentistry, the head of the pediatric odontology and prevention department of the Mohammed VI University Dental Care Center, and part of the Mohammed VI University of Science and Health. So I would love to yield the floor to Dr. Zineb Bennour, and I'm to start it off today. And again, I would just like to lastly tell the participants that there will be a feedback form that will be sent at the end of the webinar for the attendance, for you guys to get your certificate of attendance. So please be with us until the end. And if you have any questions, please keep it in your head or type it in the chat box for the end of the session to ask Dr. Zineb. So again, let's start it off, and welcome to Dr. Zineb Bennour.
Thank you so much, Mahinor. Me too. I'm so pleased today. I'm so happy to be with you in this webinar, and it's a very special invitation for me because it was made from Miriam Lhlou, who is one of my students, and which is also a member of IADS for a long time. So I'm so happy to participate with you and to be a part of these lectures. You're gonna excuse my English, which is not very, very good because I speak and I do all of my lectures in French, even if, so I'm going to try to be the most comprehensive possible. So today we're gonna talk about early childhood caries, which is a subject, a very important subject for pediatric dentists, and pathology which takes a lot of time for us to take care for children every day in our office and the hospital. We are going to understand causes, how to educate parents to have a good prevention of this pathology, and then to protect children. So, I don't move. Oh, I can't share. Sorry. I'm good. So when we said early childhood caries, we say a very big public health problem, because this is a form of virulent temporary tooth decay, which touch children in preschool age. So they are so young, they need their teeth to make social relations, to talk, to eat, to smile, to be able to live a life as everyone as every children. So it appears very soon after eruption. So many times we saw mothers who comes into the office or hospital telling us that their children, they have general pathologies because their teeth comes into the mouth yellow. It happens very quickly. The decay is on the teeth very quickly, so the parents doesn't have the time to see this decay evaluating on the teeth. It develops especially on the smooth surfaces of teeth and progress rapidly, as I said, leading to serious local and general complication. We have maybe 600 million children who are suffering from this disease in the world. It's a very big and very big and a very serious problem. The World Health Organization has put the year of 2020 as how we said this, as a year to decrease the caries on children for you can see my okay, good.
Yes.
Yes, thank you. You're gonna excuse my English, huh?
It's okay, don't worry, we're with you.
So the fixed 2020 as a year to decrease caries on the world on children under 6 years old. This goal does not, no country has gone this goals because it's very difficult to obtain these results. If we take the maps of the world, and especially in Morocco, so many studies had been done concerning early childhood caries, and especially in the area of Casablanca, which is my city. And these studies have showed that the early childhood caries are present with a very high percentage in different areas of Casablanca for different years. And it's continued to increase year after year. So it's still, and it will be a very serious problem for our children for a long time after. The American Academy of Pediatric Dentistry defines early childhood caries as the presence of at least one caries lesion, cavitary or not cavitary, or a missed tooth, donc due to decay, or a filed tooth in children aged than 71 months or younger. This type or this sort of photos, we see it every day in our practice in Morocco, in Casablanca. Casablanca is a city which is developed. The parents has an economical and social level which is elevated. And even if we still receive children with this stage of early childhood caries, which cause severe form of childhood early caries because it touch also the anterior maxillary teeth, but also molars and canines. Early childhood caries has wide range of terminology. It was called battle caries, battle feeding syndrome, anterior maxillary caries, baby battle tooth decay, and others. Why? Because it was correlated to the use of bottle feeding in the nights, and for babies and children, but also it was appeals creeping caries, because she gives a form of decay which is creeping the smooth face of maxillary teeth. We all know the etiology of carie, of decay. It's microflora. It's the substract and all these factors are influenced by other factors in early childhood caries. And we're gonna see them one by one. And this is the aim and the objective of this lecture, is to clarify the etiology about this pathology, to even can prevent it in the future. At first, we're gonna talk about nutritional and behavioral risk factors. The teeth of the children are affected by the quantity and the frequency of food containing sugar. So when we have inappropriate practices from the mother or the father with their children, they are giving them a lot of aliments and foods who contains a lot of sugars, even if this can be a good food for the children, like milk, like fruits, like all this is something which is really good for health for the children, but it contains sugar, and the contact between sugar and teeth for a long time can make and gives this form of decay. So we talks also in this early childhood caries about inappropriate breastfeeding practices. So when we give, or when we continue to give breastfeeding or bottles to a child who is 40 months or older, when he wants, as he wants, at every time in the day, we expose this child to a big quantity of sugar, which can cause the early childhood caries. Some families gives soft drinks or sugar drinks to their children to keep them quiet and sleeping in the night, which is a practice which is a very common practice in Morocco, in some countries, Arab countries, because sugar gives a good feeling to the child and gives him some good feelings to keep them sleeping. So there is also the honey teats used also in some countries, in some cultures. We take the teats and we put it on honey and we give it to the child to keep him quiet and asleep. So all this favorite or can give early childhood caries. But we have to take one moment and to be attention. When we say that breastfeeding is not good for the health of teeth of children, that doesn't mean that we have to go and say to the moms that you have to cut the breastfeeding and to not give to your son the bottle in the night. It will be, we have to respect the time, because from the born till the age of 6 months, all childs need to be breastfeeding in the night and to take bottles because he doesn't eat solid aliments. But when the child begins and starts to eat very various alimentation, we can say to the mom or to the family to stop breastfeeding their children in the night. So we have to be very careful about the message we transmit to the mothers about breastfeeding caries, because sometimes we are not understand correctly from the family, and the stopped all alimentation for their babies. So it's all about the frequency of consumption and the length of time food remains in the mouth that increase the risk of these types of caries. Sugar is present now in all alimentation for children. There is clear sugar, which means sweeties and all things that we see, but also there is a lot of sugar hidden in preparation and products. That sugar also can gives early childhood caries. So we have to educate parents to explain to them how it's very nefast to gives a lot of sugars to our children in a very early age of their life. When the child is exposed to sugar all the time, the capacity of salivia to tamponn the oral cavities is lost. So demineralization gonna take the balance of remineralization, and we will see this type of early childhood caries. There are also medicines taken from children in the night. As we know, a lot of childs can suffer from a lot of pathologies, which is very soft, but they put them in the situation to take medicines on the bed. These medicines all the time contain sugar, and are the last things which is in contact with the mouth of the children and the teeth of the children, and can be one of the causes of this early childhood career. Donc, we have to be very, very careful about this practice, which is very common in our society and our country also. There are also some eating behaviors which we find in some countries, also in African countries. For example, in Morocco, it's very usually we can find a child with some bread in his hand. He uses it as a teeth, and he can keep it in his mouth all the day. As you know, bread contains a lot of sugar, and this contact with bread and teeth can give several forms of early childhood caries, which we see usually in our practice all the day. We find also in Mali, for example, mié consumption, which is a sort of soup given to the child, and which contains a lot of sugars, and it can cause also this early childhood caries. So all these practice, all this behavior can give risk factors to see this sort of several decays. Oral hygiene habits also can participate. They don't give the early childhood caries, but they can prevent their apparitions. So when we don't have a regular, or we have an absent brushing, when we have an absent fluoridated toothpaste, who or the parents are not here to supervise the brushing of their children, we can see an increasing in the apparition of this type of decays. Another factors or element which can cause or gives this type of caries, it's the contamination, because the children's all are born with the oral health or without bacteria in their oral, but they take this from their contacts with their family. So the first person which is in contact with the children is the mother, and the mother, when she kisses their children on her mouth, when she puts the bottle on her mouth to test it, to see if it's hot or not. We're all these practices, when she tastes food with the spoon of her children, she can cause a transmission of Streptococcus mutans to their children. And here we're gonna stop and we're gonna pay attention about something which is very, very, very important. It's the mother's oral health while pregnancy. We have to take care of mother's oral health before the conception of the babies, of course, if it's possible, because this is the best way to guarantee a best oral health the children to come. But if it's not possible, during the pregnancy, we have to care about oral health of mom, to sensibilize the mom about oral hygiene and oral health, to keep the mouth of this mom less concentrated of Streptococcus mutans, because it will be the first windows to the contamination of his child. Another sort of the transmission is horizontal one, which is the exchange between children. As we see here, this small girl with 3 teeth on her mouth. Children's on her practice on the nursery or at home can share toys or other objects which contain saliva, and can also contaminate each. Host factors, the children or the immaturity of oral system of children can make this oral system more opportunist to bacterial colonization. There is also a genetic predisposition to caries, which is not yet been clearly demonstrated by science, but it can be also a factor to develop this type of early childhood caries. Environmental factors. So here we're gonna talk especially about social criteria, including parents' lower level of education, because when we make studies, we saw that we see this in most in both low level of education parents, but also in high level of education parents, because in high level education parents, the children are more exposed to the sugar and the manufactured aliment and all things that can give early childhood caries, but also in low level of education, because the mom doesn't know how to breastfeed her children, to give him bottle, etc. Mother's cultural beliefs also, here we can talk about honey and other things. single parenthood, the children's temperament, because we have some childs we cannot control. We are in the obligation to give them the battle in the night to keep them quiet and sleepy, etc. In environmental factors, we can find also the access to care and prevention for some children, which is difficult in countries which has not which are not development. The first visit comes usually after appears of cavities and in advanced stages. So this is the factors. This is the element which can cause this early childhood caries. But we have to be able to diagnose this early childhood caries, to be able to recognize it, to treat it, and even if, and this is the most important thing, to prevent it. So we, as you see in the photos at the right of the screen, you will see different stages of this early childhood caries, which can go from a simple white spot in the anterior teeth till the destruction of all the maxillary incisive area. So this is a creeping caries, which gonna destruct all the smooth face of the teeth, maxillary teeth. These lesions progress very rapidly. So it's very hard to detect them at the first sight by the parents. So usually the parents consult or come to the office or come to the hospital when the child is on this stage of pathology. Early childhood caries affects teeth according to their eruption chronology. So we're gonna see them at first on vestibular surface or maxillary incisors, then first temporary molars, temporary second molars, and then maxillary canines. In several cases, we can see the mandibular incisor canine also affected. Why these parts of the mouth is usually protected? Because the tongue comes and protect them when the child is breastfeeding. So usually they are not impacted by the decay, just in the several cases. Toujours. We will continue with the clinical aspects, and we will see here the different stages of these types of caries. So we have the the first stage, which is just how it's the white spots, which is located on the anterior teeth. You can imagine that parents cannot really detect this stage or this first attempt of these teeth. The probably can comes into your office at the age of 16 or 24 months when dentinal damage really appears with cervical cavitation, brown or black cervical bands, and in this time it's not too it's not so late to take care of the child, but it will be more difficult than the first stage. Of course, we can see also some childs with more and difficult attempts, which can gives a total destruction of this teeth. Here we have the last stage, which is traumatic damage. We can see here with a lot of pain manifestation. The child cannot sleep, cannot eat, and really it's not something which is exceptional in our practice. We see sometimes child who comes into our hospitals with these degrees of attempts in them teeth. Of course, if we don't make the treatments, we're gonna see a lot of complications, which can begin by pulp inflammation, necrosis, and some repercussions on the germ of successional teeth. But also the most important thing, that when child have all this, he cannot be able to go to school, to take to live a life like all normal children between because aesthetic repercussions can really damage the self-confidence of the child at one age, which is very important to build the personality of the future adults. And this is why this early childhood caries, it's a very big problem of public health, because it touches children in a crucial age of their life. And we have to do all our best to take care and to treat these types of decays and caries, but also, and this is the most important, to prevent them. We're gonna see some clinical cases which was treated on our hospital and during my caries. This is one of my first patients when I was intern. And she comes to the office with his mom. She was 5 years old, I think, and it was a very smart a girl, daughter. I'm a mom of all my patients, so I tell them my daughters. It was a very smart girl, but she doesn't want to smile the first time she comes into the hospital. She was very ashamed from her teeth, and she puts all the time her hand in front of her mouth to talk. And this is why the moms bring her to our hospital, because she said that she wants to go to the school. All friends are kidding, and because she doesn't have teeth, etc., etc. When we saw the clinical case, we see that all the maxillary teeth and scissors are distracted with presence of infection, a lot of decay on molar also. So we take some radiographics and we make a balance to put the treatment, the right treatment for her. And then we take care of her. We make all extraction for the interior teeth. We make also the treatment of the molars. As you see here, this is a pulp treatment on some molars. And we make her a little prothèse antérieure to give her the opportunities to smile like a child in his age. And here is our children without teeth and with her teeth at the final of the treatment of these cuties girls. Another one with the several attendants, which comes into the office. He looks like the first one, very sad. He don't have teeth. He don't want to go school. This is I talk a lot about this because it's very, very important. Behind the presence of infection, of caries, all this, we can manage it. But when we have a child which is impacted on his self-confidence, it will be very difficult for us to reverse the situation after. So prevention. This is the solution to keep our child going and growing up normally and with a lot of self-confidence and opportunities to be a good person and adults after. So here also we have a lot of caries on the anterior teeth. It's always begins on the soft surfaces of incisors, then molars. Here we see there is a lot of infections. We have a lot of manifestation of infections. We do the radiographics to see and to put the right treatment for the patients, and then we treated the patients with we do some extraction here, and we realize to prosthodontics pediatric ones to gives him the smile he deserves. So the last one, it was also a girl. It was also one of my first patients. She consults. She comes also with her mom, because she doesn't like her smile, her teeth, which is black, and also here we do the necessary and we put her donc a new teeth to be able to smile again and to be happy and to spend good holidays. So this is some clinical case. It was not as how we say it, as easy as you can imagine to take care of these children. They are very young. There are a lot of difficulty of management. They need a lot of passion and a lot of effort in the office. Sometimes we can also orient them to the general anesthesia or some ways to which are I lost my word, more difficult, I said. So the most important things, I think, that it's not right to this stage, but to be in the prevention at first. How? Educating moms about breastfeeding. We have to explain to the moms that breastfeeding from the 6 months, it's only for the day. You can give your son all he needs of nutriment in the day, but after in the night when he's going to sleep, you have to brush his teeth and to put him on his bed and to let him sleep as a adult person. La frequent of consumption of sweets. You have to control the consumption of sweets of your child. The health of mothers, of oral health of mother, it's very important. And for some of advice we give to the moms on the office or on the clinical practice is to switch the milk or the milk or the sweet soft drinks she made on the bottle of her child by putting just water. It will be difficult for the child to accept the bottle with the water, but it will be maybe an option to stop the bad behaviors who can give early childhood caries. Cleaning at the first time gummies of a child with a compress. We can do this. And now we have a lot of dispositive which is also present who can gives us the opportunities to clean the gums of the child, and also cleaning with brush teeth and fluoride toothpaste from the apparition of the first teeth on the mouth. We have to use the right ppm of fluoride toothpaste. So from 1 to 2 years, we can use 500 ppm fluoride toothpaste. From 2 to 6, we can go to 1,000 ppm fluoride. And when the children goes more than 6 years, he can use the family toothpaste without no problems. Just we have to be attention about the size of toothpaste we put on the brush for our children. So when he's too young, we have to put really small quantities of toothpaste on the brush, and when he's more older, 2 to 6, it's the size of this on his brush. The parents should supervise the brushing of their children till the age of 6, till they have the ability to take a brush and to brush their teeth correctly. And if we take all of these recommendations of prevention, we can be able to see less and less several, I will say, early childhood caries. So this was my intervention. In conclusion, I will just said that it's our we see our early childhood caries usually in our practice, but it should not be as usually as it's the way now. So we have to make all our efforts to prevent this source of caries, which damage profoundly the self-confidence of our child, and stole their smiles every day. Thank you so much. Thank you for being patient with me. Thank you, and I'm here if you have any questions. Thank you.
Thank you very much, Doctor. Honestly, it was so amazing. Really, it was really, really amazing. I know you're worrying about the English and so, but honestly, Doctor, you really delivered the point, and it was perfect. It was very homogeneous, and everyone is thanking you here, honestly, in the chat box, Doctor. Really, really thank you. I mean, you covered everything. You really it was straight to the point. It was very direct. I like the stages. You really started from the beginning, the whole idea from all aspects. So thank you very, very much, Doctor. I mean, they're already saying that it's a very helpful session. So really, really thank you, Doctor. We have a question. It says, Doctor, you mentioned that eating habits have a significant impact of the presence of such caries. Are there any alternatives to the usage of honey or recurrent feedings we can suggest to the mothers? She says, because I have seen many mothers who are hesitant to make such a change as the children become cranky.
Can you repeat, please? Just a part.
So she's asking, basically, Doctor, you said we should change the idea of not giving them honey to something else. So she's saying, what other alternatives? So what are the other things that she could
Water,
use?
water.
Water. She
Just water.
says that the main issue too, that she's seen many mothers when they change this into the alternative, the child becomes very cranky.
Yes, yes,
So the
yes.
mother, so what do you think should the mother do, or to help aid the crankiness, to make it easier? So the mother would actually have the incentive to actually change the habit.
Yes, yes, I understand. Really, we are dentists. We are also doctors, so we have to be to accompany to help these mothers to change the habits. So we have to see her every day if it's necessary, to talk to her, to explain her that it will be just a moment, then the children will understand that he will not have the bottle in the night, he will not have the teats on in the night, they will not have the honey. And you can imagine it will take time, it will be very hard for her, for all the family, but at the least they will have the change, and the children will understand. And because when we had some attempts like this, like several one, we don't have a choice. Even if we're gonna do the restorations and treatments, all this, if the habits are not changed, we're gonna have the same statue 6 months later. So we have to be able to change the habits before we start the treatment of this early childhood caries, because this is the case of the success of your therapy. So I know it's very hard. We explain to the mom that it will be hard. They will not sleep for nights. The child will be very angry. So normal, because we take sugar from here his habits, and it's very difficult to accept for a child who is habitually consume sugar a lot. So water and bottle, teeth, if we can if we can take it off, definitely it's a good thing for him. It's not to not put it on milk, on honey. So, and to have patience to pass this time.
Thank you, doctor, very, very much. And thank you very much for this session, honestly. And I have my own question. Throughout your experience, doctor, what is the main advice or prevention that you found was most effective in your experience, regardless of evidence? What have you seen that really, this is the go-to, this is, if the patient or the mother or basically the child does, it would really help you throughout all your work and to prevent caries? Like, what was if you're gonna give like the golden advice, what would it be?
Fluoride toothpaste.
Fluoride toothpaste?
Yes, because even if the mom breastfeed her child in the night, if there is an apport of fluoride, which is a consequence, we can make remineralization of lesions at the first stage, and it's very important. So when there is no brushing, no oral hygiene, here we see the several forms. But there is a source of oral habits and fluoride toothpaste. The stage or the lesions are less important. So brushing, and using fluoride toothpaste in the correct ppm for age. It's very, very, very important.
Perfect. Thank you, doctor. Thank you very much again. It was very informative. It was amazing. And the golden rule, I'll use it. I'll use it around. I'll keep. I'll refer it always to you, doctor. So thank you very much.
I want just to I want you to excuse my English, and I hope to have the opportunities to do lectures in French with translation to be more.
We'll consider that. Yeah. Oh,
Okay.
I get what you mean, Doctor, 100%, and we'll consider that. And thank you for your time, and thank you for
Thank
the
you.
effort with the language,
Thank
with the
you. Thank you
presentation,
for
with
you.
everything, and for your time. And hopefully we'll repeat this again in a different time, in a different manner. But well, thank you very much, Doctor, and thank you
Thank
again
you.
to all our participants. Thank you
Thank
for
you.
attending, and looking forward to see you again, guys, tomorrow. So
Mm.
thank you, Doctor, and thank you, everyone.
If you
Merci,
don't,
Bye-bye.
if you don't mind,
Yeah.
may I have
Oh,
one question also for the doctor? I was
Yes.
oh,
wondering,
okay.
thank you. How does the thumb sucking and or the pacifier use affect the risk of early childhood caries, and what should be the right usage of the pacifier actually? How often they should give them the pacifier, the mothers, or they should not? What do you think about I mean the dummy, you know, when the mother gives them, how often they should give the children, or they should not even, they should avoid using it?
Can you please
Repeat the question, yeah?
yes, I'm sorry because it
No
was
worries.
one
Okay.
moment. Okay.
Well, I would like to ask first, like, how does the thumb sucking or the pacifier use affect the risk of the early childhood caries? And then, like, how often the mothers should actually give the children the pacifier, how often they should use it, or they should even avoid using it if it's like a risk thing to use. Pacifier, I mean, it's the dummy.
Okay. I didn't understand the question really good, so
I think Yana means how should we use the pacifier correctly to not cause any consequences? Am I right, Yana?
Exactly. What is the right usage? Like, if mothers should even avoid using it, or
pacifier
yeah.
okay.
So what would be the right time, or the right how many times, or what should we have? Like, do you have what is the right way to use it so it would not affect the child? Like, is there a protocol to use it? Is there timings? Is there something you should do before and after?
Especially the night before putting the child on on his bed, you can take it, put it on your fingers. It's how we said it. It should be with water. It should be put water on it to not be damaged the gum of the child, and to clean all the dam all the mouths of the child. And this is it. One times a day before going to sleep. It's very enough. It's enough for having a good oral health.
So it doesn't matter how many times he uses the pacifier throughout the day, and the most important thing is before he sleeps.
Yes.
Right. Okay.
And important is to keep it clean, like the hygiene. That's the important part. Like, they can use it, but it should be always clean.
No, you have to use only
one time.
Only one time. You throw it up and you take another one for another day.
Okay, all right.
You don't have to use the same one all the times after.
All right. Thank you very much.
You're welcome.
Thank you, Doctor. Thank you, everyone. And the webinar is recorded for you guys if you would like to rewatch it again and it's going to be uploaded on our YouTube channel. So see you guys tomorrow, and thank you all very much, and thank you again, Dr. Zineb. It was a pleasure. Thank you, and thank you, Anna.
Merci, madame.
Thank you. Bye-bye.
Bye bye.